heads up. So today we are talking about gut health. If you haven't already met me, I am Sarah Wiseman. I am your chronic condition manager for the city. So I help with the wellness points and work at the clinic. I'm also a registered dietitian. So you are obviously here for gut health. Today we're talking about celiac disease to ulcerative colitis. So just a quick outline of what we're going to be covering. Everything from peptic ulcers to celiac disease, diverticulitis, irritable bowel disease, and colon cancer. We're hitting the main big structural disorders of the GI tract today. Part two, just kind of to stay tuned and kind of a teaser here, we're going to get into more of the functional disorders, and hopefully we can kind of help explain the difference between the two of those, but that's going to get more in the gut microbiota, which is a really fascinating topic. Some issues with constipation, diarrhea, bloating, flatulence, and gas, GERD, and IBS, which if you notice, some of those are symptoms of, and you'll kind of see there's symptoms of some of the other issues, which again, we'll kind of get into and dive into, and we'll kind of touch on some other things that can go on with the GI tract. So quick overview to get started of the GI tract. We have this wonderful system that starts with our mouth and goes through the esophagus, the stomach, into the intestines, and through the colon. So digestion actually starts in your mouth. If you're if you look at all the food that we eat, just quickly break it down into three nutrients that actually comprise of calories. You have carbohydrates, protein, and fat. So if you're looking at food groups, carbohydrates are largely in your grains, fruits, some vegetables. It's in all vegetables technically, but more in like starchy vegetables like potatoes, peas, and corn. You have proteins in meats, and carbs are in dairy and meats. And then you have fats that are in some of these foods, but they're also in nuts and seeds and things like that. So looking at the big picture right there as far as the nutrients. As you eat, carbohydrates start to get digested in your mouth. Food goes down into your esophagus and into your stomach. You have a little flap here that keeps it from going down the wrong pipe, the epiglottis. You get in the stomach. The stomach has a good bit of acid. You also have a little muscle ring called a sphincter here that helps keep the acid from going back up the wrong pipe. So acid reflux, which we're going to get into next time, has to do with that as well. So stomach has three types of mixture to the fluid. It's fluid. It has enzymes that help break up the food we eat. It has acid that helps kill off the pathogens, and it has hormones. The hormones help signal the gut to start contracting and help the gut start moving. It also helps keep the gut going in the right direction. And it also lets us know when we're full and hungry. So those are the important roles of the hormones from the stomach. And the normal pH of the stomach is somewhere between 1.3 to 1.5. And it's usually 1/2 to 3.5 ounces of fluid. Not as important, but to give you a perspective of how acidic this is, it is slightly less acidic than battery acid. Roughly the acidity of lemons or your soda here, or grapefruit juice. So as we keep going down, food goes from your stomach into your intestines. Your intestines have three different parts to them. You have the first part, the duodenum, your jejunum, and your ileum. Not as important. You can say first, second, and third part. It'll impact nutrient absorption. But the small intestine, amazingly enough, is roughly 23 feet long. There's different numbers. Some say 17 feet, but 23 feet long when you stretch it out. So that's pretty impressive. And this is where you're going to have food stick around in here for roughly 6 hours. So it's going to be helpful to kind of see what this is like. You might have heard that 70% of your immune system is in the digestive tract. And if you haven't, 70% of your immune system is in your GI tract, which this is partially why. You have these finger-like projections in your small intestine. These help absorb nutrients along here. And the nutrients can be absorbed any point along these little fingers. You also have these tight junctions in between the cells. So this is one cell And each cell has these little finger-like projections on it. And these cells are really, really close together. So let's say you have a nasty bug get into your mouth and it manages to get down to your mouth and your stomach. Well, now it has to survive that nasty acidic stomach. All right, it manages to get through the stomach. Well, now it has to either manage to squeeze in through these little finger-like projections and somehow get out from the mucus, because the mucus will trap the bugs. But then you also have these tight cell junctions that act kind of like bouncers at a bar and keep the bugs from being able to get in. And then as soon as the bug even is able to get in, then it still has to deal with the immune system cells from your blood cells, your immune cells inside. So pretty impressive as far as all of that your digestive tract can do. But as soon as you have food leave the stomach, it has a smoothie-like consistency, or at least it's supposed to. A smoothie-like consistency called chyme. And that chyme goes into our small intestine. And you have this large surface area there to absorb it. But this is where you start to have the pancreas and the liver come in. The pancreas is helping produce enzymes to help break down some of that food. And the liver and the gallbladder both have the bile to help break down fats. So some of where people have issues is if their pancreas is not really helping out the way it should, because it's supposed to help regulate your blood sugars, and it's also supposed to help with breaking down proteins and some of those carbohydrates. The liver could also be having some issues, or the gallbladder. If you've had your gallbladder taken out, you might not be able to digest fats quite as well. And so bile is helping digest fats, and that's where those two come into play. As we keep moving on, you get through the small intestine. You have the 2 to 6 hours in your small intestine, and you get into the large intestine. And this is the colon. This has 4 primary functions to it. 1, water and electrolyte reabsorption, waste compaction, some nutrient absorption, so B12 and vitamin K, we'll talk about that. And it's the home to our microbiota, which we're going to talk about more next time. As you look at this, here's your digestive tract in a straight line. So hopefully this all makes sense. You have your pancreas, your acid from your stomach helping break stuff down, your pancreas help breaking stuff down, and your gallbladder sticking in the bile to help digest the fats. And this is where everything's getting absorbed. So this is your small intestine, and this is your colon. The liver is kind of like the processing plant. So everything pretty much goes through the liver to help process a lot of this stuff. Fat and protein have to go to the liver to be processed. Glucose or carbohydrates can usually go straight into the bloodstream and go to where they're supposed to go. All that being said, so this is kind of the backdrop. This is what it's supposed to look like. I hope I didn't lose anybody, so feel free to ask questions if I did. When things go wrong with the GI tract, it's either usually a structural issue or a functional issue. So structural issue being something's wrong with the layout or the shape or the building block structure of the GI tract, improperly made building. Functional issues are where the structure is okay, but it's just not working right. So you have a flat tire, all right? You could just have the air be out of the flat tire, and then that's just a functional issue. If you have a nail or something in the tire, then that's going to be a structural issue, and you need to fix the structural issue before you put the air back in the tire, right? So you want to address structural issues first, which is why all of the stuff we're talking about today is the structural issues. Because if that's not right, then you're going to have functional issues. If you're having all of the structure be right, you can still have functional issues, but that's going to be addressed slightly differently. So let's get into it. So just quick note, all of these conditions, it's something that you should definitely talk to your providers about and seek their advice. But hopefully this helps give you some insight as far as like, hey, these are the issues I've been having and some things to talk to them about. that is my goal. If you have other issues going on from a nutrition perspective and you have questions, I'm happy to answer them at any time. But there are acute, so those short-term problems that could be lasting days, weeks, those kinds of short-term, or there's chronic issues. And so that's going to help the provider, and like if you're coming to me as far as knowing, hey, this is something that's been going on for a while, this is going to be a little bit different. There's always those kind of GI bugs that can come around and cause short-term issues. And just a quick note here too, things that we're not going to dive into. I'd love to dive into a lot of stuff, but these are not going to be gone into quite as depth. I'll quickly cover them here for a second, but for one of two reasons. One, they either impact an organ that's works with the digestive tract, but isn't necessarily part of the digestive tract, like the liver or the pancreas. The second reason it might not be covered is if it's a pretty unique case that's pretty rare, we can address it privately too, but gastroparesis is going to fit into that first kind of category. It's kind of a weird, rare sort of thing. It's usually associated with diabetes, but it's a slowing of the digestive tract. So that transit time, everything's just slowed down. So it causes early satiety, early fullness, bloating, and some discomfort. Again, it's not as common. They do have some diagnostic things that they can do to check it out, but not as common. Gallbladder disease usually ranges infection or inflammation of the gallbladder, blockage, so you get gallstones. Worst comes to worst, they'll take out the gallbladder. Gallbladder just stores bile. So when they take it out, your liver has to produce more and work a little bit harder, and it takes some time to learn to do that. So high fat foods can cause a lot of issues for people. So fried foods and things like that. So might be good to watch out for that. Pancreatitis usually lands you in a hospital visit. It's quite painful. And again, the pancreas is producing some of these enzymes that are helping break down food. So if the pancreas is irritated and inflamed, it's not able to break down all of the food that you're eating. So usually you go to a clear liquid diet and then slowly progress your diet back up. Hepatitis is inflammation of the liver, and the liver is producing that bile. So it can cause issues again, some of the high fat foods, but it's also our processing unit. So it can cause issues there. It's usually caused by an infection, and it can also be caused by too much alcohol. Pancreatitis can also be caused by too much alcohol. The liver is processing the alcohol. So always a good thing to keep that in moderation and just watch that and know your limits as far as how much you can really tolerate for it too. So colostomy, ileostomy, bowel resections, these are all taking out some form of the digestive tract. So again, going back up to this, if you're taking out any part of this, it's going to impact what's getting absorbed. So again, not as common, not going to discuss it. Short bowel syndrome, again, you're taking out some of the small intestine typically, so you're not absorbing as much nutrients. But getting into more of these topics, peptic ulcers are first. So if anybody's had an ulcer, it's quite painful. It is more of that acute setting. So out of all of these, this is more of the acute, not long-lasting conditions. It's just short-term. And it is an ulceration in the mucosa of the GI tract. So you have this mucus layer and it gets in there. H. pylori is responsible, and H. pylori it's a bacteria. It's responsible for 70% of gastric ulcers and 90% of the small intestinal ulcers for that first part. So the duodenum. And so you can get ulcers here. But it can occur in the second part of the small intestine, not as common. It's usually related to a foodborne illness. So that's one of the common reasons for getting the ulcer. Another reason is high dosage uses of non-steroidal anti-inflammatory drugs. So your ibuprofens, your aspirins, corticosteroids, prednisone. If you use those for a long time, you're going to be more prone to ulcers. H. pylori, just kind of tidbit of information, it interferes with the mucosal lining of the small intestine, so it makes it easier for the acid to get in there, cause that nice little hole. Treatments for it are typically antibiotics, so definitely a visit to the provider to talk about it. Meds to help block the acid production so that it kind of allows this area to rest and heal, and acids to neutralize the stomach acid. So again, reducing the stomach acid. Lifestyle remedies, finding some other pain relieving medications other than NSAIDs. There are other options. Tylenol is a common one for like the acetaminophen. Stress management. Stress can worsen signs and symptoms of ulcers. So it's something to be super aware of, especially if you're starting to have a lot of GI issues when you're stressed out. Really bad GI issues too. Tobacco use also makes you more likely to have stomach ulcers and increases your stomach acid production, which interferes with the stomach lining. So that doesn't negate either chewing tobacco, so smoking, chewing tobacco. And then also limiting alcohol use. Eating wise, there's nothing specific. It's kind of while you have the ulcer, it's kind of what you can tolerate. Reducing acid production, so high acid foods like tomatoes or citrus might not go as well. More of the brat diet as far as bread, rice, applesauce, toast. If you are not familiar with the brat diet, always good when you're feeling sick or having GI issues. Celiac disease is a hot topic for a lot of people, or has been at least recently. It's an autoimmune disorder. So when you think of autoimmune disorders, think about the body's attacking itself, kind of like type 1 diabetes or rheumatoid arthritis. We'll talk about a couple others, thyroid disease. So the body is attacking itself for some reason. And celiac is fairly common. It happens in 1 in every 133 people. So what happens with it is, if you remember these finger-like projections, these become dulled in celiac disease. And the reason being, so the body's reacting, any autoimmune condition, the body reacts to a specific type of protein. And you can think of proteins as kind of like these little Lego structures. Proteins are made up of amino acids. And so each amino acid kind of is like one little Lego block. You put them all together, you get a specific Lego structure. Essentially with celiac disease, the Lego structure involved causes this dulling in this body to attack itself. So that leads into what is gluten. Gluten is a protein and it's found in wheat, rye, and barley. And that's what's causing the body to attack itself, that specific Lego structure. And it pops up in everything. And I mean, everything. We'll see a list on the next slide, but it's even in like salad dressings. So there's a long laundry list of things that it can do. But and the immune response is this damaging of the mucosa in the intestines. So these get worn down. You get more gaps in between the cells, so you're more prone to infections. But also, with this being decreased, you have less area for the nutrients to get absorbed. You also are having more diarrhea because things aren't getting digested. They're not getting absorbed. Things just rush through the intestines. It has to be diagnosed though. They have to find that little IgA. There's other things that it could be. Gluten sensitivity is something we'll talk more about in the next part of this. It has similar symptoms, but there's not that actual damage done to the intestinal lining. So that's the big differential there. And you want to make sure that you get that diagnosis because 2 reasons. One, if you have to avoid gluten, you have to avoid gluten, and you want to make sure you avoid it in everything. There's always like a certain threshold for anybody, but the threshold for those with celiac disease is much, much smaller, and you're going to get that immediate damage, and it's going to cause that long-term damage. 2, again, with gluten sensitivity, you're not getting this intestinal damage, and you don't want to necessarily cut out foods you don't have to. So there's some health benefits to having wheat and barley and rye, but if you cut them out and you don't have to, it's not as helpful. So risk factors, genetics, females more than males, Caucasians, common diseases associated, other autoimmune conditions, type 1 diabetes, thyroid diseases, rheumatic diseases, liver diseases, and immunoglobulin A deficiency. So immunoglobulin A is an antibody that helps fight infections. So immunodeficiency, or like any autoimmune deficiency, a condition, typically you're more prone to get infections. Symptoms, and you're going to see this with a lot of these different conditions, is bloating, diarrhea, constipation, gas. I know the diarrhea and constipation are kind of contradictory, but those are both symptoms. Lactose intolerance due to damage of the small intestine. So the enzyme that helps digest lactose in milk actually sits on the top of those little finger-like projections. And so if you have that damage, that lactase enzyme is not there to help digest the lactose. Loose, greasy, bulky, or bad smelling stools, nausea, vomiting, and pain in the abdomen. So treatment is a gluten-free diet. You want to check foods and condiments. Again, it could be in salad dressing. It could be in a lot of condiments. It sneaks up in a lot of things that you wouldn't think it'd be in. It's not in meat because it's not a carbohydrate source, but it doesn't have wheat, barley, or rye. But yeah, medications, it can be in supplements, Play-Doh, cosmetics, lipstick, lip gloss, lip balm. It can be in skin and hair products. It can be in toothpaste and mouthwash, and communion wafers. A really, really great resource is the Canadian Celiac Association. They have a huge list of all the foods that, one, you should avoid, but also a huge list of foods that you can eat. I think that's the big thing, is a lot of times these kinds of things show you all of the foods you can't eat, and it gets very depressing versus focusing on what you can eat. So they have a great, great list of that. And if we have time later, I can pull up their website and show you that one. Diverticulitis is a super common condition. So, and it can get really, really confusing for a lot of people. So this is in the colon. So here's the small intestine back here. This is the large intestine, the colon. And you get these little pouches on the part of the colon. And these little pouches stick out. And so if you just have the pouches and you're not having any issues with it, that's termed diverticulosis. Anytime you see itis at the end of the word, think inflammation. Because if something gets into that little pouch and irritates it and inflames it, that's where you get diverticulitis. And so you can have both, technically. It's the same thing. One's just the inflammation of it. So risk factors for it: age, genetics, having a low fiber diet throughout your life, lack of physical activity, obesity, smoking, medications. So again, your non-steroidal anti-inflammatory medications and your steroids. Signs and symptoms: abdominal pain, constipation, diarrhea, fevers, chills, nausea, vomiting. You don't have to have all of them, but you can have some of them. Sometimes people find out they don't have any symptoms and they just find out they have diverticulosis, and that can happen pretty commonly too. A lot of times if you're having diverticulosis, an inflammation, so the diverticulitis, that pain's going to come on pretty suddenly and worsen in several days. The intensity can change over time. So this is another, it's a chronic condition, but can have like those acute little flare-ups. So the treatment, this is where it gets a little bit confusing, so stay with me, is typically a high fiber diet. So if you're thinking high fiber, think whole grains, vegetables, fruits, anytime you're eating the seed and the skin. And then there's different types of fiber, which we'll talk about in a little bit, but anytime you're eating the skin and the seed of something, it's going to have more fiber. If you're eating a banana, you peel off the skin, so you're not getting quite as much. If you have broccoli, it kind of looks like a tree. It has a lot of fiber. So if you're not having any symptoms, any irritation, it's good to gradually introduce a high fiber diet, because this has been shown to help prevent and reduce flare-ups. However, if you do get a flare-up, clear liquid or a low fiber diet with the inflammation. So that's more of your brat diet, the bread, rice, and applesauce, toast. Bananas would really actually be fine too. Not a lot of fiber in them. Sometimes they'll give you antibiotics. Meds did help decrease the inflammation and pain. Probiotics, again, probiotics, it's been shown to be somewhat helpful there. Again, all of those bacteria, those helpful bacteria are in your intestines. So keeping them, probiotics are essentially those healthy bacteria in your guts. Irritable bowel disease. So this again, there's been a lot of confusion around this one. Chronic inflammation of the GI tract. So there's two types. There's Crohn's disease and ulcerative colitis. Both of them are irritable bowel disease. So the differences between them is Crohn's disease can happen anywhere along the GI tract, from the mouth all the way down to the colon. It usually starts in part of the small intestine before it gets to the colon. Usually it's in the intestines, but it can happen anywhere along the whole thing. You get patches of inflammation, and the inflammation goes through multiple layers of the GI tract wall. So you'll see that more on the next slide. So if you're a little confused, but you can also get these little strictures, which you'll see why. Ulcerative colitis is only in the colon. It usually starts in the rectum and continues to spread up the rectum. And it causes inflammation only in the innermost part of the intestines. So ulcerative, remember that word ulcer, you get the little holes, and we'll see that in a second here too. So Crohn's disease first. Here's a side picture of the intestines. You get this inflammation. So here's normal. You get this inflammation, this swelling. It's impacting every layer. You can get cobblestone kind of surfaces inside the intestine. You can get fat buildup along the sides, and that's going to cause and kind of squeeze and cause those strictures. So if you're having, again, this is another one that goes through active bouts versus where it kind of calms down. If you're having an active bout, it could be diarrhea, fever, fatigue. So again, you're having this kind of inflammation and irritation in the intestine. It's not going to be able to absorb things well. So you're going to feel more fatigued because you're not getting the nutrients you necessarily need. So reduced appetite and weight loss, pain and drainage around the anus, cramping, mouth sores. Not fun stuff. Iron deficiency anemia, delayed growth, all kinds of problems here. Causes for it are typically because you're having an immune response to a virus or a bacteria. I've seen some stuff that even like a tick bite to when you get like Rocky Mountain spotted fever or something like that, that kind of virus injection. Or it could be genetic. It's more likely to happen in young people or Caucasians if you have a family history of it. Again, cigarette smoking, and then NSAID medication too. Treatment, medication management. So they usually, once they diagnose it, you're diagnosed with lab tests, stool samples. Usually they'll do a colonoscopy. So they're looking up the lining of the colon and the intestine and checking it out to see what's really going on. They'll give you a medication management, but typically if you're having that bout, if you're having that kind of flare up, you want a low fat, low fiber diet, high protein, high calorie, avoiding really high fatty foods and high fiber foods. So vegetables, make sure they're really well cooked. You might want to avoid some vegetables, especially ones that have the oxalate in them. Oxalate's commonly in like spinach or broccoli. It's been termed an anti-nutrient. It kind of can bind things up and make it harder for things to get digested. So avoiding those kinds of foods. And as you're able, just gradually returning to a normal diet, slowly increasing the fiber. Again, I emphasize slowly increasing fiber. If you increase fiber too quickly, you could cause another flare up here too. Sometimes they will do surgery to remove damaged portions of the intestines if you're having a really hard time. Supplements. So again, like your GI tract's severely implicated with this. You have a lot of inflammation, a lot of problems, and depending on your growth requirements and how functional your GI tract is with all of these kind of structural issues going on, what medications you're taking, if they've had to take out any part of your intestines, you might need some more nutrients, iron, folate, B12, zinc, magnesium, copper, vitamin D, vitamin C, E, and K. Vitamin K is especially vitamin K and B12. I mentioned earlier, they're absorbed in the large intestine, in the colon, where it largely is. And then calcium. Ulcerative colitis, we're going to see kind of similar patterns. But again, this one is not in the entire lining. You're just getting these ulcerations in the colon. So again, you're going to have issues absorbing and digesting things because you have little holes here that aren't supposed to be there. diarrhea, you get blood in stools, abdominal rectal pain, weight loss, and fatigue. And again, it's going to be classified by where it is. So if you remember, the colon kind of has the up, across, and down. So you have the ascending, transverse, and then descending colon. So they're gonna classify it based off of where it is in the colon. But generally it starts from the end, from the rectum. Causes, genetics is a big one, abnormal immune reactions. It could be related to your microbiome, which again, we're gonna talk about in part 2, which is great. And it could be related to the environment. So there's some things that we could do about it. Risk factors, typically you start developing it before the age of 30. Another one that Caucasians, Ashkenazi, which I could totally be saying that wrong, Ashkenazi or having a Jewish descent and a family history of it. Treatment, again, they're having to do this colonoscopy. They're doing the same kind of lab test that they would for Crohn's disease, but medication management. Again, if you're having a flare-up, you're going to have these times where you have flare-ups and you're going to have times where it's fine. Medication management, low fat, low fiber, high protein, high calorie diet as tolerated during the flare-ups, and then a normal diet as you can. Again, looking at those high oxalate foods that could be causing problems. Again, oxalates are commonly in types of vegetables. So if you need, I'll get you a list of low oxalate kind of vegetables too. And again, they might do surgery to help take away some of the parts that aren't really working well or causing more issues. And the same list of nutrients that could be needed depending on your status for ulcerative colitis. So that kind of brings us to colon cancer, which is the last grouping here. Last one we're talking about for today. Colon cancer, it's pretty prevalent in America. 1 in 20 Americans will develop colon cancer in their lifetime. It involves a change of bowel habits. So going from having constipation to having diarrhea, or diarrhea to constipation, or frequency in bowel movements. Starting to have narrower, smaller shaped stools. This is going to be consistency over time, not one day. So don't freak out if you're like, oh, I'm having diarrhea now for today. But bright red or very dark blood in your stools. If your stools start to look black, that usually implies blood as well. So just a heads up on that one. Ongoing or abdominal or pelvic pain and bloating, unexplained weight loss, nausea or vomiting, feeling tired all the time. Colon cancer involves changes within the DNA, which leads the cells to growing out of control. And real quick, looking back at this too, it starts as this tiny little polyp that kind of develops. So if any of you have had colonoscopy and they said you have a polyp, it starts as this. The polyp usually kind of goes in the middle, and the cancer will start in the middle of the polyp. And by the time it gets to the 4th stage, it is spread through the lymphatic system to go out. So that's when they talk about metastasis. If you have metastatic cancer, it's gone to other areas of the body as it works its way out and goes into other tissues. So risk factors, usually over the age of 50, having a family history, and Crohn's disease or ulcerative colitis are a risk factor for it. That's a big deal. So if these things aren't managed, that's going to be a huge clue into risk factor for colon cancer. It's important to have these managed and doing well. Having a family history of polyps or having a personal history of breast, uterine, or ovarian cancer. Prevention, removal of the polyps. This is why it's super important to make sure you're getting your colonoscopy screenings. I know our company, if you hear about colon cancer screenings from our company, Forever Side, they are doing a huge push for it, but it's important to get your colon cancer screenings. A lot of people put them off with a pandemic and they couldn't do them with the pandemic. So making sure you're staying up to date on that. Having a diet high in fiber, fruits, vegetables, whole grains, and nuts can help prevent. Diet low in nitrates and processed meats also helps prevent colon cancer. And that's a big thing too for like risk factors for any colon diseases, diverticulitis, Crohn's disease, ulcerative colitis, usually help preventing it is having that high fiber diet. Hopefully it'll help make more sense when we talk about the microbiota in the next visit session here, but a diagnosis of it's usually by colonoscopy, proctoscopy, biopsies, CT or CAT scans if the cancer has spread. There's some other treatment is usually surgery, chemo, radiation's not as common, but it can be done, and immunotherapy, which is, if you haven't heard about immunotherapy, it's a pretty exciting area of cancer treatment now. Usually significantly less side effects and good outcomes. So that's an encouraging thing. In summary, there are a lot of different things that can impact stomach pain, tummy pain, GI pain, bloating, gas. Check in with your provider. Recommendations are based on what you have. If you have a structural issue going on, great, we need to figure that out. We need to fix the nail in the tire and get that out of the tire before we can patch up everything and then get the air back in the tire. So we need to rule out other issues. Biggest prevention of major issues is early detection. So the earlier you catch it, the earlier you can do something about it. Nutrition does matter. It's going to change based on your diagnosis and kind of if you have that flare up. Fiber can help, but there's going to be certain points that can hurt. If you have whole grains and you have celiac disease, that's going to hurt. But generally fiber is going to be a great friend for you as far as GI health. I do not get tired of saying anything about having a high fiber diet because it helps a bunch. Structural disorders, again, kind of looking for next time, we're going to be getting into functional disorders. So structure's okay. It's just not, things aren't working quite like they should. You're still having some of those symptoms, even though nothing's inherently wrong with the structure. It doesn't mean that there's air in the tire. There's some things that we can do. So we're going to be getting into, again, microbiota, constipation, diarrhea, bloating, flatulence, GERD, IBS. These are some different sources. So that's going to be in the fall. Next month, we have a lunch and learn on the 19th on mental fitness. And so this is going to be presented by Charisse Hairston and going over ways negative thoughts impact your happiness and a 10-second technique to decrease stress and increase well-being and a 7-week mental fitness program. So that's coming up next month. Any questions? Kind of pull up the chat box here. Yes, cyclic vomiting syndrome is rare. Colon cancer is prevalent. So I think that would have to do with not many people meet the fiber recommendations in the United States. And so fiber really is a huge prevention for colon cancer. And a lot of people are developing ulcerative colitis and things like that. So I believe it's like 90% of people do not meet the fiber recommendations. The fiber recommendations are roughly like 35 grams of fiber per day. That's huge. So just getting fiber in your diet can be super, super helpful. That is my biggest suspicion as far as rates for colon cancer. Oh, I had one person say, anybody else not able to hear me? I just saw this, I'm sorry. All right, so I'm hearing some people here heard me fine. Any other big questions here? Thanks, Diana. All right, well, if you have any questions, I'm sorry I didn't put my information on here. I will put it into the chat. You can feel free to call me, email me, text me, whatever works best for you. If you have a private question, and I will hang on here for a little bit so you all can get that. But otherwise, I hope you all have a great rest of your day. And I look forward to seeing you all next month for the mental fitness. And we have some other exciting webinars coming out here too. So I'm excited for that for you all. Thanks, everyone.